videos? Okay. So may mga nakapanood naman. Okay. Sige, so for today, uh, we will review yung digestion and absorption and a little bit about the lower GI concepts and accessory organs of the pancreas. Yeah. So to start, 'di ba, sabi nila, you are what you eat. 'Di ba this is true? Yan. So 'di ba, technically speaking, what we eat are your macronutrients, 'di ba? And we are also made up of macronutrients, yan. So wala lang. So you make your own choices dito kung healthy or bad food yung gusto niyo. Okay. So to start, so this will be our objective. So I'll give a brief summary about the things I've posted about the digestion and absorption of the macro and micronutrients. Tapos second part would be about some clinical conditions affecting those things, digestion and absorption and nutrition. Okay? So you've seen this, 'di ba? These are the primary functions of the GI tract. And for okay, for our topic kaya nga digestion and absorption, we will mainly focus on these two. Okay? So when we say digestion, what do we mean by digestion? Sige nga, for those who watch the materials, in your own words, how do we define digestion? Ano na lang chat to everyone na lang 'Wag na directed to me. Okay, breakdown of food. Okay, breakdown of food into smaller particles. Okay? So 'di ba when we say digestion, it's either you have your mechanical process or a chemical process. But the main point of um digestion is to actually convert. Yes, that's the right term. Convert a complex or a big or a macromolecule and convert it into a smaller, more absorbable form. Okay? And if you can remember the absorbable forms of our macronutrients are their monomeric units. So for carbohydrates, that would be your the three monosaccharides, glucose, fructose, galactose. And then for your proteins, that would be your amino acids. And then for the lipids, that would be your free fatty acids. Okay? When we say absorption, what's your how would you define this? Absorption. Okay. So good. So it's mainly the transport, okay? The transport of those digested materials either into the bloodstream or into the lymphatics. And once inside those circulation, they are transported now to the other organs. So one of those organs would be the liver. Okay? Sige. So for example, you have ayan, nagtitipid, Burger McDo muna. Yan. Pero bad food daw, sige. Let's change it into a healthier food. Yan, sandwich daw. So remember that when we take in food, these are the things that we eat. Okay? So majority would be uh carbohydrates. Okay? Um these carbohydrates are approximately 60% of what we eat. Ayan. And then followed by proteins and lipids of varying proportions. And we also have your micronutrients. Okay, so yung micronutrients, these are your vitamins and some of your minerals. So we can still get them from the food that we eat. Okay. Now, for example, we ate a sandwich. So what are the things that would happen, okay, as we eat something? Okay. So for this, the way I would summarize this is per segment of the GI tract. So this is in contrast to what I've shown you in the video wherein uh, per macromolecule yung discussion ko. But for this one, let's look at each segment of the GI tract as uh, food is being processed. Okay, so first one in the oral cavity, in the mouth. So what are the things that could happen? Okay, so first question. So which of the following enzymes here is responsible for the initial breakdown of carbohydrates in the mouth? So, ayan, I'll launch a poll. Hindi, doon na lang kayo sa poll mag-answer. Yan. So, I'll probably give you 10 seconds to answer. Ano ba tayo? 500. Okay. Sige. So, I'll end poll na ha. Yan. So, very good. So majority of you answered salivary amylase. So, how would you describe your salivary amylase? What is its action? So from the name, amylase, and it's salivary, meaning to say it's secreted by the salivary gland, and it actually, yan, it converts your complex carbs to monosaccharides. Actually, hindi. Hindi pa. Yan. Tignan natin. So, what happens in the mouth, wait lang may nakaharang ba sa screen? Wala. Okay. So what happens in the mouth with regards to your carbohydrate digestion is that the the process of mastication or chewing would mechanically break down food into smaller particles into making the surface area greater. Now, at the same time, your salivary amylase would act on specifically your starch or those containing your alpha-1 for bonds. So starch, what else? Glycogen. So it would act on those things. Okay? And producing a product. So the products can be your dextrine and some of your glucose. Yan. So so with regards to carbohydrates, ganun lang, matatapos siya doon. Okay? Next. Next question. So where does protein digestion begin? Uh, so in here, so kindly answer. So I'll end the poll if we reach 80% of the participants. Yan. So where does protein digestion begin? Is it in the mouth, esophagus, stomach, small intestine? So definitely for carbohydrates, it's in the mouth, di ba?
Uy!
For this one, I forgot to put chemical digestion. Yan, specifically. Kasi nga pwedeng mechanical, 'di ba, for the process of chewing. So this one, I'm referring for this one, chemical digestion. Okay, so hindi na nadagdagan. Okay, sige, I'll stop share. I'll end the poll pala. Sorry. Yan. So, majority answered letter C, pero some answered D and A. Esophagus, eliminate niyo na yun. Wala namang wala, esophagus is primarily for motility functioning, 'di ba? Yan. So, wala na siya. Okay. So, sa mouth, uh, do we have an enzyme? Well, mechanical digestion can occur kasi nga because of chewing. But with regards to chemical digestion, we do not have an enzyme that would digest protein that is secreted in the mouth. So definitely, mouth is not the answer. Okay? So the best answer for this one would be letter C, stomach. Okay? Yan. Yan. So again, we do not have an enzyme. Okay. Now, for the lipids, so again, we also have the process of chewing. We also have this lingual lipase, which is again from the salivary glands. And this lingual lipase would preferentially uh, break down triglycerides that would contain your short chain fatty acids, such that the product produced or the reaction of your lingual lipase would be this one. So it preferentially releases your short chain fatty acids. Okay, but my question is this one. So is lipid digestion lipid digestion mainly starts in the mouth. So is it true or false? Wait lang ha. Ayan.
Ay, no, no, no. Sa stomach. Mm-mm.
Uh, huh? Okay. Eh, Hindi umabot ng 60%. Ayan, 60%. Sige, pwede na to. Okay. Sige, let me share the results. Okay, so majority answered false. Why? Okay, lingual lipase is only responsible for 10 to 15% activity. Okay, that's true. Pancreatic lipase is more effective. Okay, true also. That's correct. Pero with regards to the activity of your lingual lipase, where is it more active? Is it more active in a basic environment or in an acidic environment? Okay, acidic. Okay. Such that even though lingual lipase is secreted in the mouth, it is not active. It will only be active once it reaches an acidic pH, which is in the stomach. Okay, so the answer here is false. Okay, okay. Well, with regards to micronutrients, not much happens for with regards to the absorption of the vitamins and minerals. But what is important here is you have a factor that helps in the absorption of your vitamin B12, which is your haptocorins. So this is also secreted by the salivary gland. Yeah. So we'll discuss what this haptocorins later on as we go along. Okay, next. So we're done with the mouth. So again, as I've mentioned, esophagus, it does not have any um, function with regards to digestion and absorption. So mainly for motility functioning lang siya. Yan. So the next segment now would be the stomach. Okay. So what are the things that happen in the stomach? Okay. So first one is when the food reaches the stomach, it again, this is a review of what was discussed in upper GI, 'di ba? So when the uh, wall of the stomach is distended, it will cause the secretion of gastrin. So G cells would secrete now your gastrin. Now, what does this gastrin promote or do? That results in increase in HCl. Anong ginagawa ni gastrin? Is converts pepsinogen? No. So gastrin is a hormone, it's not an enzyme. Okay, so ito na nga, ito pala nilagay ko. It increases your HCl production. Okay. Now, it increases your HCl production by activating or by making the proton pump more active. Yung hydrogen potassium ATPase. Yan. So by making it more active, more HCl is being pumped into the gastric lumen. Okay? Sige. Now, with regards to carbohydrates, so of course, since we are in an acidic environment now, your salivary amylase will be inactivated. So carbohydrate digestion stops in the stomach or decreases in the stomach. Okay? Now, next thing that happens is, so we're done with carbohydrates. So with regards to proteins, yan. So all are function of HCl except yan. So promotes protein denaturation. Letter B, hydrolyzes peptide bonds. C, converts pepsinogen to pepsine. D, kills certain microorganisms. Take note, this is an exact question. So which is not a function of your HCl. Okay. Sige, I'll end the poll. Okay, so these are the answers. Your answers. Okay. So majority answered letter B. Okay. So take note. So letter B is the correct answer. Okay. So HCl does not have uh, a hydrolytic, well, it does not have a protease function. So it does not hydrolyze peptide bonds, or it does not cut the peptide bonds present in the dietary proteins that we take in. So letter B is the answer here. Okay. So letter A, your HCl actually promotes protein denaturation. Remember in biochemistry, di ba? Our proteins, when they are exposed in extremes of conditions, so high temp, low pH, high pH, it would cause protein denaturation. So same is true with the dietary proteins that we eat. So when it is exposed in an acidic environment, you have protein denaturation. Now, this protein denaturation is actually advantageous because by denaturing certain proteins, we are actually opening up the active sites of these proteins, making it more accessible to your enzymes. Yan. So, mas nagiging digestible yung, hydrolyzable yung denatured proteins. Another thing that can happen is that actually this is another important function of your HCl. It converts pepsinogen to pepsin. Okay, so uh, proteases, so enzymes responsible for breaking down proteins, are initially produced in their inactive forms, zymogens. So these are yung may mga gens in their name or pro in the at the start of the enzyme's name. Yan. So one example here is your pepsinogen. So upon exposure to HCl, this pepsinogen is converted into the more active pepsin. Yan. So si pepsin siya na yung magbe-breakdown ng certain dietary proteins. And then lastly, HCl being a strong acid can also inhibit and kill certain microorganisms. Okay, so yung answer here is letter B lang. Okay? May question. Doc, for example, the patient consumes entamoeba. How come the HCl? Ah, Yan nga, kaya ko na nilagay na ano. That's why I put here certain microorganisms because you will learn later on in microbiology that there are microorganisms that are resistant to this acidic environment of our stomach. Yan. But for some, it can HCl can still function, can still kill them. Yan. Okay? So here, so again, HCl and your pepsinogen, these are the important factors with regards to your stomach that is associated to your protein digestion. Yeah. Next. So again, together with your lingual lipase, your stomach would also produce your gastric lipase. But again, together with your lingual lipase, this accounts only for a smaller percentage of your lipid digestion. And in terms of function, it's very similar to your lingual lipase. So it releases your short chain fatty acids. Okay. Now, uh, these short chain fatty acids at this point, they can uh they can be absorbed kasi nga it's small enough, and at the same time it can readily diffuse across the membrane of certain cells, thereby it can be absorbed now into the circulation. So note that your short chain fatty acids here, when they are absorbed uh, through the portal circulation, through the bloodstream. Okay? Next, with regards to your micronutrients. Okay. Now, um, at the level of the stomach, okay. So your haptocorine would eventually bind now to your vitamin B12. So it would form a complex with your vitamin B12. Now the function of this haptocorine B12 complex is it actually protects your vitamin B12 from being broken down by your HCl. Okay? Or from being destroyed by the HCl. Now at the same time, the parietal cells would also secrete your intrinsic factor. So intrinsic factor, this is another factor necessary for the absorption of your vitamin B12. Okay? Next. So let's now go to your duodenum. Now, when you have your chyme, the acidic chyme coming from your stomach, when it now reaches the duodenum, it causes the secretion of these two hormones, your CCK and your secretin. Okay. Now, question is, sorry, hindi ko pala na-stop share. Yeah. So question is, which is not an effect of CCK. So is it gallbladder contraction, relaxation of sphincter of OD, stimulation of your pancreatic acinar cells, or promote bicarbonate secretion? Okay? Parang pakonti ng pakonti yung nag-a-answer nung poll. Okay, sige, I'll stop na. Okay, so let's look at each choice choices. Yan. So your CCK or your cholecystokinin, this is secreted in response to your the presence of your amino acids and fatty acids in the duodenum. So your CCK, it's there are actually four functions of your CCK, four main functions of your CCK. So number one, it stimulates your gallbladder to contract. So by doing so, it promotes bile flow into the duodenum. What else? It causes letter B, relaxation of the sphincter of OD. So yung sphincter of OD again, it's the structure here sa sa duodenum, which drains the secretions coming from your pancreas and from your bile duct, from your gallbladder. Okay. Another function of your CCK is it stimulates your pancreatic acinar cells to produce the enzymes. So be it your amylase, lipase, or your proteases, CCK increases the secretion of those things. Or in other words, the primary secretion of your pancreas. Okay? So the answer here is letter D, your bicarbonate secretion. Because what causes this bicarbonate secretion? Okay, it's the other hormone, your secretin. Okay, so with regards to your secretin, so when you have your acidic chyme that reaches the duodenum or that enters the duodenum, the S cells there would uh, secrete secretin. Now after that, what will secretin do now? Where will it act on? Neutralize the acidic chyme? No. Well, that's the end effect. Pero where will secretin act on? Kasi 'di ba secretin is a hormone. It's not an acid or a base, 'di ba? Okay. So it acts on your pancreatic ductal cells. Okay, so si pancreatic ductal cells, 'di ba? Remember this is a portion wherein you have the wherein bicarbonate is being secreted into the lumen in exchange for chloride. Okay, so what your secretin does is it actually promotes the secretion of bicarbonate into your ductular lumen. So making the pancreatic secretion more basic. Okay? And by doing so, once this pancreatic secretion is secreted into the duodenum, the bicarbonate there uh, neutralizes the acidic chyme. Okay? Sige. Okay. So, with regards to duodenum, this is the main organ or main region for the digestion of your carbohydrates, proteins, and lipids because this is where your pancreatic enzymes are secreted. So with regards to your carbohydrates, you have your pancreatic amylase, which would now break down your starch or glycogen into these things, your maltose, maltotriose, isomaltose. But again, eventually, these things are not in their absorbable forms. So it would travel further down in the small intestine until it is acted upon by the brush border enzymes. So specifically, in the brush border, you have your disaccharidases. Okay? So these disaccharidases would act on your disaccharides, freeing up your glucose, galactose, and fructose. Okay? After which, since they are in their absorbable forms already, your glucose, galactose, and fructose will be absorbed. Okay? So take note that the transporters, your SGLT1 and GLUT5, are located on the brush border or apical border of the enterocyte. And opposite to that, on the basolateral, you have your GLUT2. So GLUT2 is responsible for transporting uh, the monosaccharides from the inside of the enterocyte into the interstitium and eventually into the portal circulation. Okay. Now, I have a question here. So which transporter and mechanism are correctly paired? So SGLT1, primary active transport, GLUT2, facilitated diffusion, GLUT5, simple diffusion. Okay. So try to remember LE1. Yan. Okay. Sige. Okay. So majority answered letter B. So let's look at A and C first. Okay. Letter A. So your SGLT1, your sodium glucose co-transporter type 1. So this is an example of what? Is it a primary active transport ba? Okay. It's a secondary active transport. Okay. Diba? First LE pa lang, I've introduced this one already. So this is a secondary active transporter. Okay. Letter C, your GLUT5, this is not a simple diffusion because for us to say simple diffusion, it does not require carriers or transporters, di ba? Okay, that's why it's facilitated. So the best answer here is your GLUT2. Okay. Okay. So good. You still remember your LE1. Na-share ko na ba? Ayan. Okay. Sorry. Okay. Next.
Hey, connection.
Okay. For proteins, okay. So these are the things that happen with regards to your protein digestion. So first one is because of the increasing pH, your pepsin activity decreases or pepsin is inhibited. Okay. Now at the same time, because of your of the presence of your CCK, trypsinogen will be released into the duodenum. So trypsinogen initially will be acted upon by your enterokinase to become your trypsin. Trypsin, on the other hand, will activate your other zymogens. So it can activate itself, trypsinogen, what else? Your proelastase, your procarboxypeptidase, chymotrypsinogen. Yeah. All of those will be activated. And then located on your inside your enterocytes. So take note, this is not in the duodenal lumen, ha? But rather on your inside of your enterocytes, the cell itself. So they have intracellular peptidases And on your brush border, you have your aminopeptidases. Okay, all of which can act on your dipeptides and tripeptides. Yeah. So these are the products now of protein digestion after it is acted upon by your proteases. Okay, so you have your free amino acids. So once you have your free amino acids, they are in their absorbable forms. So they are absorbed via a sodium-dependent co-transporter. The mechanism of which is a secondary active transport as well. And then you have your di and tripeptides. So these are absorbed. So they are absorbed via your uh, proton-dependent transporter. So once inside the cell, they are acted upon by your intracellular peptidases, your di and tripeptides, upon which the product is your free amino acids. And then you also have your oligopeptides. So for oligopeptides, this is a somewhat a bigger molecule. So it can be absorbed via endocytosis or uh, a paracellular route. Okay? Wait. Um, can you go back po to the previous slide? Sorry, mabilis pa. Wait lang ah. Previous slide. This one? Okay. So is there a question about this slide? Okay. Sige. Sige, sige, I'll upload this. Di ko pala na-record. I'll upload this PowerPoint na lang in Canvas din. Okay? Okay, so this is the products of your protein digestion. Okay. Now, with regards to lipids, okay, so this is a little bit different because, again, for lipids, for them to be acted upon by your enzymes, okay, by your pancreatic enzymes specifically, they must be, what would be the process first prior to the action of your pancreatic lipases? They must be emulsified, okay? And the emulsifier are your bile acids, okay? So, once you have your emulsified fats now, it's acted upon by your pancreatic enzymes. So you have your pancreatic lipase, which also needs the action of your colipase. Diba? So your colipase here, it's a factor that increases the action of your pancreatic lipase. Yeah. So the action of your pancreatic lipase would be as follows. So it breaks down your triglycerides into a di or monoglyceride, freeing up your fatty acids. Next, another pancreatic enzyme is your phospholipase A2, which hydrolyzes your phospholipid now, freeing up your fatty acid. And then you have this lysophospholipid as a product. And then another, your cholesterol esterase. So this is an enzyme that frees up your free fatty acid and free cholesterol from your cholesterol ester or cholesterol ester. So again, products of your lipid digestion are as follows. So you have your free fatty acids, you have your di and monoglyceride, you have your free cholesterol, and your lysophospholipid. Okay, may question. Is lysophospholipid the same with lysolecithin po? Lysolecithin is an example of your lysophospholipid. Parang lysophospholipid is a more general term. Yan. Okay. So what happens next after the action of your pancreatic lipases? Okay. So together with bile, okay. So let's go back to bile first. So remember, bile is a steroidal uh, uh, molecule. So when we say steroidal molecule, it comes from your cholesterol. I think this was discussed by Dr. Bautista in his in saan nga ba? Sa accessory organs, yan. So your bile acids is your cholesterol is converted into bile acids in the liver. So you have your cholic or deoxycholic acids as your primary bile acids. Now, these bile salts or bile acids pala, they are there are two types, diba? Your primary and your secondary. So the primary are the ones produced in the liver. The secondary are the ones produced after the action of your colonic bacteria in the colon. Yan. Now, there is a process that recycles these bile salts known as your, what do you call that process? Ito. Okay, so this is your enterohepatic circulation. So enterohepatic circulation. So entero means intestine, hepatic going back into the liver. Okay? Now, what is important here is that once the bile acid is goes back into the liver, it can undergo the process of your conjugation. Okay, conjugation process. So your bile acids can be conjugated with your taurine or glycine to become your glyco or toro bile acids. Now, what would be the purpose of this conjugation process? Okay, so very good. It enhances the polarity or it makes them more water soluble. Kasi remember, bile acids as it is, they are amphipathic. They have a polar and a non-polar uh, uh, property. Now, by adding this taurine and glycine, they make it more water soluble, making them a, yeah, that's the right term, better emulsifier. Okay? Sige. Okay. Now, remember the products of lipid digestion earlier. So these are the products together with your bile acids. They will now form your mixed micelles. Okay. So these mixed micelles, these are the transport form of your lipid byproducts as it moves across the small intestine. Okay. So as it moves along the small intestine, once it reaches the certain area, for example, yung brush border, it can readily diffuse into cells. So once it diffuses into cells, 'di ba? They become re-esterified with your free fatty acids, producing now your triglycerides, cholesterol esters, and your phospholipids. So parang back to the initial substrate, 'di ba? Parang gano'n. So this is this one occurs inside the enterocyte pala, ha? Inside the cell na. Okay. Now, this triglycerides, cholesterol esters, and phospholipids, they will now be uh, packed in together with your other other apoproteins to become now your chylomicrons. Okay. Now the chylomicrons, they are absorbed through the lymphatic circulation. So 'di ba this is in contrast to the one I mentioned earlier, yung short chain fatty acids. So yung short chain fatty acids together with your monosaccharides and amino acids, they are absorbed through the portal circulation, yeah, through the blood. So yung sa lipids, they are absorbed through the lymphatics. Now, aside from these things, you also have the fat-soluble vitamins coming from the diet. So your ADEK. So they are also packed together inside the chylomicrons. Yan. Okay? So next. So we're done with carbohydrates, proteins, and lipids. So na-absorb na sila. Let's now proceed to your micronutrients. So with regards to your micronutrients, so we're done with fat soluble. So let's look at your water soluble vitamins. So mainly your water soluble vitamins, your B vitamins plus your vitamin C, they are generally absorbed via a H plus or a sodium dependent co-transporter. Yeah. So that's the general mechanism. Except for your vitamin B12. So remember vitamin B12, 'di ba? In the stomach, 'di ba? You have your haptocorine B12 complex. Now, once this haptocorine B12 complex reaches the duodenum, the pancreatic proteases will hydrolyze the bond between them, freeing up your B12. Now, at this point, B12 will now bind with your intrinsic factor. Yan. Now, si intrinsic factor, siya naman yung guide ni B12 as it moves along the small intestine. Yan. Medyo maarte si B12, di ba? Yan. Now, uh, it will continue to move until it reaches the terminal ileum, wherein B12 is absorbed through a receptor-mediated endocytosis. So, of course, at this point, the intrinsic factor will dissociate from your B12, and then your B12, once absorbed, it will be transported into the bloodstream together with your transcobalamin, yung protein, the transcobalamin. Okay? Next. With regards to your electrolytes, medyo marami to, di ba? So, just remember that your electrolytes, the absorption of your electrolytes actually depends on two things. Your dietary level. So, if you are ingesting lots or high amounts or low amounts of sodium, for example, and the blood levels. Okay. And then for this one, take note of the movement of the ions. If it's absorption or secretion or absorption and secretion, and take note of the transporters. Okay. Okay. So generally, these three, so your sodium, calcium, and your iron, the process is your absorption. So absorption from the intestinal lumen into the interstitium. So this is in contrast to these three ions, your sodium, your potassium, chloride, and bicarbonate, wherein it can be absorbed or it can be secreted. So when we say secreted, the direction is opposite from the interstitium back into the lumen, intestinal lumen. So of course, if it is in the intestinal lumen, as it moves along the GI tract, it can be excreted if it's not absorbed in a more distal region. Okay? Next. Okay, so note that the substances that are not digested or absorbed or eventually secreted will eventually reach the colon. And this will now form the fecal material or stool. Now, let's look very briefly at your defecation. Okay. So, for example, defecation. So, you now have the fecal material that reaches the rectum. Okay. So, my question is this one. So, mass movement. So, colonic mass movement. Does it trigger defecation? So, true or false? Okay. Hindi na nadadagdagan. Okay, sige. 5 more seconds. Okay. Hala, majority answered true. Okay, let's define first. What do you mean by your mass movement? Mass movement. What do you mean by that? Movement of feces or sige, let's say movement of the colonic contents along the colon. Okay, powerful propulsions. Okay, it's a propulsive movement, 'di ba? As what Dr. Bautista defined. So it's a propulsive movement that whose function is to move the contents distally. Yan. So this is in contrast to the mixing movement which is your haustrations, 'di ba? Okay. So yung question dito mass movement in the colon triggers defecation. So actually the answer here is false, 'di ba? Okay. So why false? Kasi 'di ba the only function of your mass movement is to move the colonic contents. Defecation will be triggered if masyadong marami na, the pressure in the rectum is very high, such that it stretches now the rectal walls. So my point here is that mass movement can help, di ba? But it does not always trigger defecation. Okay, so the answer here is false. Okay, next. May next question pa ako. Yan. So which occurs during defecation? Wait lang ah. Launch ko lang yung... Ay, wait lang. Ayan. So which occurs during defecation? Yeah, 5 more seconds. Okay, so let's end the poll and then share results. Okay, so good. The correct answer here is all choices are correct. Yeah. So 'di ba you have the defecation the defecation reflex as it is yung intrinsic defecation reflex wherein when this when the rectal wall is stretched because of an increased pressure in the rectum, it causes it sends this reflex. Now what happens is that there will be relaxation of the uh, internal anal sphincter. But the intrinsic defecation reflex as it is not strong enough to actually cause the propulsion of the fecal material. So there is such a thing as your parasympathetic defecation reflex, which uh, which increases the peristaltic movement, or rather, which increases the motility. Kaya nagmo-move yung further, greater yung contraction of the GI motility of this one. Yan. At the same time, um, during defecation, what happens is that there will be relaxation of the puborectalis muscle. By the puborectalis sling which wraps around this one. So when it is relaxed, the anorectal angle is greater, and at the same time, the the posture that we do during defecation, yung squatting or sitting position, would further widen the anorectal angle. Yan. So, mas madaling dumaan yung fecal material. And lastly, because of this, be- because of this parasympathetic defecation reflex, it can also send signals into the brain, and wherein it will tell us that, 'di ba? Remember that your external anal sphincter, this is voluntarily controlled. Okay, so it will tell us that we can now relax the external anal sphincter. So when both anal sphincters are relaxed, yeah, that's the time that the fecal material can now move outside. Yeah. So yun yung review of um, defecation. Okay, there are questions here. Wait lang. What if the statement becomes mass movement in the colon initiates defecation? Hindi pa rin siya true. Yan. Yan. Maybe the proper wording is mass movement in the colon may. Kasi may or may not initiate defecation. Remember that the defecation would always depend on the pressure inside here. Yan. Another question, is it true po, Doc, that squatting is better than sitting when defecating? 'Di ba in as what was shown to you in the video ni Dr. Bautista, when we squat, the anorectal angle is wider. Yan. It's more obtuse. Yan. Kaya kaya siguro mas better yung movement of the fecal material when we squat. Okay? So any other questions about defecation? Sige. Basta kung may further question kayo, put it in the chat, in the discussion board nila. Okay. Okay. So, sige, we're done with the first part. Sige, let's have a 5-minute break. 5 minutes lang kasi short na lang yung next eh. 5-minute break before we proceed to the next part. Okay? So be back by 9:40. Yan. Sige. So, sige, while we wait, let's look at okay, may question. Is the examination of the abdomen included po? Yes, It's included. So I'll have a short reminder later about the experiment. So another one, Doc, I encountered a patient who at times have a hard time defecating, and her caregiver said it helps when she massages the muscles around the anal region. Why is that? Oh, I think this one, yung rectal stimulation as what we used to call it. So parang the process here is the same as this one. You are causing stretching of the rectal walls, 'di ba? So by doing that, you 'di ba? Remember in the introduction in GI, 'di ba? When you stretch the receptors, when you stretch the walls, it causes contraction of the smooth muscles. So the concept is similar to that. Okay? Sige, let's proceed na sa sige, thumbs up na if you're good to go for the next part. Okay. Okay. Sige. So for this one, I have four cases that's associated with your digestion and absorption. Okay. So case one, RJ, I'm not saying I'm this one. A 23-year-old male medical student presents this doctor with abdominal pain, bloating, flatulence, and diarrhea after drinking Vietnamese latte, 'di ba? Kasi ba Vietnamese latte merong condensed milk and evap milk ata yun. He also noted similar symptoms whenever he ate large amounts of cheese. And then he denies fever, sick contacts, or recent travel. So his father has a history of similar symptoms. Now, my question is, which is the expected Bristol stool type in patients with diarrhea? So, try to remember the Bristol stool chart. Kaya, tingnan natin. Yan. So, which one is expected in patients with diarrhea? So, 'di ba the Bristol stool type, as what was this described, it's a tool used to give us an idea, the doctors, to give us an idea of what the characteristic of the stool of your patient. So, is it type 1, type 4, or type 7? Okay, sige. So, let me share the results. Okay, so majority answered type 7. So, that's actually the correct answer. Ta. So, this is your Bristol stool type chart. Yan. So, you have your type 1 and type 2 being seen in constipated patients, and then 6 and 7 being on patients who have diarrhea. So, the 3 and 4 are the ones that are considered normal. Okay? Yeah. Now, Um, RJ here is diagnosed with lactose intolerance and is given a medication to avoid dehydration. And then he was also advised to avoid or limit the intake of dairy products. So this is the this is what happens in lactose intolerance. So 'di ba normally the left side here shows what happens in normally. So your lactose, 'di ba? It is acted upon by your brush border enzyme lactase, where it is broken down into glucose and galactose, and eventually it is absorbed. So lactose and glucose and galactose do not reach the colon. Okay? Now, on the other hand, in lactose intolerance, since you have deficiency of your lactase here, lactose is not digested. Now, lactose being an osmotically active substance, it will attract water with it. That's why you have diarrhea. Okay? Now, at the same time, lactose, once it reaches the colon, it is acted upon by the colonic flora, wherein because of it is fermented and products of your fermentation would result to the production of your CO2 and hydrogen gas, which contributes now to flatulence and bloating. So usually common symptoms in lactose intolerance are diarrhea, abdominal pain, what else? Bloating and increase in flatulence. Yeah. So your lactose intolerance, this is yan, as I mentioned, it is part of your disaccharidases deficiency. Yeah. So in your disaccharidases deficiency, it results now in what we call as your osmotic diarrhea because the carbohydrates would attract water, osmotically active substance. So it would result in osmotic diarrhea plus the production of your carbon dioxide and hydrogen gas. Yeah. Now, disaccharidases deficiency can be caused by a lot of things. It can be genetic, for example, uh, absence of your sucrase isomaltase, for example, uh, certain intestinal diseases wherein the brush border is being destroyed, malnutrition, or certain drugs. Yan. So this is an example of your genetic, your congenital sucrase isomaltase deficiency. So imagine this patient cannot tolerate sucrose, table sugar. So they cannot break down sucrose. Yeah. So the management for this one is to actually uh, avoid or decrease sucrose in the diet. Yeah. Or you can give or they can be given enzyme replacement. Lactose intolerance, this is what was in the case. So there's an age-dependent loss of lactase activity. 'Di ba? As we grow older, the expression of lactase from our genes would be inhibited because hindi naman milk yung main diet natin eh. So lactase expression decreases. Yan. So treatment here is again to avoid lactose in the diet or 'di ba you have your lactose-free dairy products. Yan. So you can use that or you can they can take in lactase pills. Yan. Okay. Okay, next case. So si RJ ulit. So presents to his doctor with difficulty in defecating about once every 5 days. So no other symptoms were noted. And then for the past month, he was binge eating, mostly samgyupsal. So yung meat only, hindi kasama yung veggies. And was noted to have been taking more than 3 cups of coffee per day. His usual bowel movement pattern is once every 1 to 2 days. So upon physical examination, there was no abdominal tenderness and distension noted. And on si Dr. Tan daw yung kain ng kain samgyupsal. Pero hindi nagko-coffee naman, 'di ba? So on digital rectal exam, so when the doctor uh did the digital rectal exam, it was noted that there is the presence of hard lumpy stools. So Bristol stool type 1. So if you can remember, if it's type 1, it is Diarrhea or constipation? Constipation. 'Di ba? The type 1 is characterized as your goat stool like stool. Yan. Okay. So this is a case of constipation. Okay. So the patient is diagnosed with constipation and he was advised to increase intake of fibers and to increase water intake. He was also advised to decrease coffee intake to 1 to 2 cups per day. Yan. Coffee is life daw kasi. Yeah. So what would be the function of your fibers here? So your fibers, this is uh uh part of your non-digest or this is another name of your non-digestible carbohydrates. So from the name non-digestible. So our body do not have or does not have an enzyme that will break down these types of carbohydrates. Example are your cellulose, inulins, and your pectins. Okay. Now what does it do? Okay. So being non-digestible, so it will reach the colon unchanged. Ganun pa rin as it is. Okay. And then at the colon, there are partially hydrolyzed by the colonic bacteria, which can trigger or can irritate the the colonic wall, thereby facilitating motility. Yeah. Now, at the same time, it has this effects. So it can help in weight maintenance. It helps in constipation kasi nga it promotes motility. And it has an effect on your lipoproteins. But the requirement here is that the patient must be properly hydrated. Now, what would be the reason? Because fibers, what happens when it is with water? What happens to your fibers when in the presence of water? Okay, so they will absorb water, 'di ba? They will absorb water, making their weight greater. So they would form bulk inside the colon. Now, when they form when they increase weight because of water absorption, they tend to stretch further the colonic wall, thereby facilitating motility. Yeah. So that's the function of your fibers. Okay. May nagtanong, Doc, if you're lactose intolerant po and you have constipation, can you just drink dairy po to relieve it? Weird. Drink ka na lang ng ano, take na lang ng fibers kesa kesa ano, baka mag-diarrhea ka naman kasi 'di ba? If you have if you're lactose intolerant, 'di ba? Yan, may questions. Doc, ano po nangyayari kapag uminom ng laxative or Dulcolax? And then also, effective po ba yung psyllium fiber or husk? Um, Psyllium fiber, the mechanism is similar to this one, your fibers. It takes in water. It's a bulk forming laxative, yung psyllium fibers. Laxatives generally they are medications that would facilitate the passage of stool. And there are a lot of types of laxatives. Yan, may mga laxatives na ganito, bulk forming laxative. There are laxatives that would irritate the colonic wall, and by irritating it, it promotes motility. And there are laxatives that would form coats around the fecal material, and by doing so, it facilitates the passage. Yan. So yun yan. There are a lot of things, a lot of types of laxatives. Doc, how many times in a week should one defecate? This is actually this would vary from person to person. That's why it's very important. Balik lang ako few slides. That's why I put here ito, the last statement in the first paragraph. So it's very important that when you ask patients about, or when you are considering constipation or diarrhea, you should ask the usual bowel pattern. Kasi for example, if ito, the complaint here is once every 5 days, and if you ask this patient, for example, that yung normal niya is still once every 5 days, I would not consider, less likely I would consider constipation. Kasi baka yun yung normal niya talaga, eh. So it's very important to ask the patient itself, himself pala. Okay? Another question here. Is it true na if you take laxatives for a long time, you can become dependent? Yes, there are certain types of laxatives that can cause dependence. Yeah. Another question. Question lang po. If you're considered lactose intolerant, if your tummy acts up po if you drink whole milk, but other types of milk, okay na. Um, you have to what's the proper term for that? You have to differentiate lactose intolerance from what's the other condition? Uh, insensitivity or hypersensitivity. I forgot. It's a bit different. Yan. In lactose intolerant kasi, you do not have the enzyme itself, which causes the diarrhea. This is in contrast with, I forgot the other term, eh. Sige, ilalagay ko na lang sa ano, sa discussion board. Okay, remind me ha, remind me. Ayun, dalawa na yung nagtanong about that. Um, Another question, can people develop some type of resistance or tolerance to laxatives? I'm not familiar with tolerance to laxatives, but I'm sure yung dependence meron. Yeah. Wherein if they stop taking the laxative, they would have constipation. Ang daming questions about this one, ah. Is it true po that if someone is naninibago with the food they ingest, they tend to defecate more often? Aha. I'm not sure about this one. Naninibago? Parang ano ba yun? Like first time na kinain? Ganon? I'm not sure about this one. Uh, Another question, is it true po that laxative abuse will cause patchy-like patterns? I think for the stimulant, laxative, yung the one that causes inflammation. Yan. So it can cause certain inflammatory lesions kasi nga it irritates the the intestinal wall. So it can cause patchy-like patterns. Yan. Um, malabsorption, which one? I think in malabsorption conditions, the problem there is either your body is not able to absorb. So either your transporters are defective or saturated. That's why you have malabsorption. Yeah. Is it true if you don't eat beef specifically for 10 years, but you eat pork, that when you eat beef again, it can give you an upset stomach? I'm not sure about this one. Okay. Sige, I'll check. Oo. So parang nagkakaroon ng ano ng uh, loss of expression of certain protein siguro. But I'll check this one, Jose. So again, kindly put this one in the discussion board. So I'll answer there. Okay. Doc, immediate inflammation po ba pag irritant type of laxative? Yes. Hello po, Doc. Ang daming question about lactose intolerance. Will exposing yourself to milk like drinking or eating dairy products eventually make you tolerant? Yes. 'Di ba there is a I'm not sure if you've discussed this in biochemistry, 'di ba? 'Di ba yung the mere presence of lactose, 'di ba? It causes expression of your lactase eventually. So, if you expose yourself to lactose, siguro small portions of lactose, eventually your body will increase the expression of your lactase again. Yan. Okay. Wala nang question. Okay, sige. Ayan, I can vouch mo. So someone may ano nag-answer. I was born with lactose intolerance, but my parents kept mixing milk with soy milk and eventually pure milk na lang po. Yan. Doc, how long po a lactose intolerant person becomes a lactose tolerant? I'm not sure how long. Yan. Sige, let's check na lang journals about this one. Okay? So again, put this one in the discussion board. Right? Hmm. Ako din, I think I was lactose intolerant. Yan. Pero ngayon, ano, I can tolerate na. Yan. Okay. Next case. So si RJ ulit. So because of his binge eating, he was becoming overweight. So one of his friends recommended taking Orlistat to lose weight. So Orlistat ito, Senical. Diba? Now, he noted that few days after taking the drug, there was flatulence and presence of oily streaks on his underwear. Okay. Again, I'm not saying I'm this one. Hindi to based from experience. So purely ano lang to, fictional. Okay. Now, what happens in patients taking uh Orlistat? Okay. So in your this is something to do with abnormalities in your lipid digestion and absorption. So it can be caused by certain things. So pancreatic insufficiency. So if there is pancreatic surgeries, so you remove certain areas in your pancreas that such that the secretion of your acinar cells would be affected. Cystic fibrosis. Was this discussed in prior ba? Or are you familiar with cystic fibrosis? Yes. So what about the others? So cystic what sige, what happens in cystic fibrosis? So from the name cystic fibrosis. So there is a defect on your CFTR. So CFTR is your cystic fibrosis at CFTR, transmembrane conductance regulator. Yan. So this is your CFTR. If you've heard of CFTR, it's actually a channel. It's an ion channel. Yan. So later on, papakita ko na lang later yung CFTR. But just remember, CFTR, cystic fibrosis, you have a problem with your CFTR. which affects your pancreatic secretion. Okay. Next, aside from pancreatic insufficiency, if you have bile duct obstruction, so of course, bile is important in lipid digestion and absorption. Bile acid deficiencies, example, if a patient underwent resection, surgical removal of the ileum, kasi that's where your uh, bile acids are being reabsorbed or can enter the enterohepatic circulation. Diba? And if you take in drugs such as your orlistat. So si orlistat kasi, this is an inhibitor of your pancreatic lipase. So it prevents the breakdown of your triglycerides. Yan. So symptoms would be this one. So since you are inhibiting the digestion of your lipids, what happens to your lipids now is it will eventually reach the colon unchanged. And then once in the colon, it can acted upon by the colonic flora. Again, fermentation occurs. You have increased flatulence. And then the presence of of fatty greasy stools is because of the passage of these lipids uh yon down under. Yeah. So this is a condition known as your steatorrhea. Yan, yung increased passage of lipids through the feces. Okay. Now, aside from lipid digestion, this one can also affect your protein digestion. Yeah. So when this usually occurs when you have pancreatic secretion, deficiency in pancreatic secretion. So for example, ganun ulit, surgical resection of the pancreas, cystic fibrosis, chronic pancreatitis can also affect your proteins. So same as with your lipids, there is passage of undigested proteins in the feces. Okay? So last case. So still RJ. Yeah. Went to his doctor kasi he had diarrhea again for the last 2 days. He stated that he just returned from his province and that the diarrhea began suddenly and is described as watery. So no abdominal pain or blood in his stools. On examination, he appears to be dehydrated and his stool appears like rice water. Yeah. The patient is diagnosed with an infectious form of diarrhea, which is most likely due to your Vibrio cholerae, so cholera. Okay. So I have a question here. Ayan. Yeah. So which is transported by your CFTR? Wait lang. Yeah. So what do you think? Is it your sodium ions, chloride, potassium, or bicarbonate? So again, CFTR, this is the one affected by or defective in your cystic fibrosis. Okay? So CFTR can be found in certain areas in the body. Meron yan sa respiratory system, meron sa GI tract, can also be found in certain exocrine glands. Yan. Okay, so end poll. So share results. Okay, so the correct answer here is your chloride ions. So your CFTR is actually a chloride channel. So majority of you are correct. Yeah. So let's look at your CFTR. Yan. So your CFTR, it's this one. Just to orient. So again, this is your enterocyte. This is the uh, lumen of the intestine, and this is the interstitium. So note that your CFTR is present all throughout your small and large intestines. Yeah. So what does it do? So your CFTR is it's actually activated by your cyclic AMP and calcium. So this one. So anything that increases your calcium intracellularly and your cyclic AMP intracellularly can open up your CFTR. Yeah. So your CFTR, when it opens up, it's a chloride channel. When it opens up, chloride now moves from the enterocyte into the lumen. So there is chloride secretion. Okay. Now, when your chloride is secreted into the lumen, this makes the lumen more negative. So, di ba, if it's more negative, it tends to attract positive ions, one of which would be your sodium. So, sodium can move, can cross or can move into the lumen, taking water with it. Kasi nga, remember, where sodium goes, water also follows. Yan. So, when your chloride is secreted, you also secrete sodium ions and water. Okay? So, this is the function of your CFTR in the small and large intestine. Now, in your exocrine pancreas, specifically the duct cell, you also have your CFTR there. So, again, the function of your CFTR there is similar. It transports chloride out into the ductular lumen. And by doing so, it increases the chloride content of the ductular lumen. After which, the chloride there can power your bicarbonate chloride exchanger, which pumps bicarbonate into the ductular lumen. So the function of your CFTR is it actually it's important in alkalinizing the pancreatic secretion. Yeah. Okay. So is it clear why lipid digestion and protein digestion as well as carbohydrate digestion is affected in cystic fibrosis? Is it clear? Thumbs up nga if it's clear. Okay. Sige. Okay, so going back to this one. So we're in the small and large intestines. Okay. So what happens? My question. I think this is with regards to cystic fibrosis. How is this process related to their affected lungs po? So same. Uh, being if your CFTR is defective, so in the lungs, so chloride ions cannot be secreted. So what happens is the secretions, the consistency of the secretions becomes thicker. Kasi nga walang ions, walang sodium chloride and water. So the secretions become thicker. Yan. Okay. So going back to this one. So in your cholera, okay. So what happens is that the microorganism, your Vibrio cholerae, would secrete your cholera toxin. So this cholera toxin, this would activate a G protein coupled receptor, okay, which in turn increases the intracellular cyclic AMP. Yeah, so this is the effect of your cholera toxin. So it increases your intracellular cyclic AMP, which again would open up more of your CFTR. So more chloride is secreted, sodium and water follows. That's why the consistency is rice water because the 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 content of the stool is your sodium, chloride, and water. Para siyang rice water, yung consistency niya. Yan. Okay? Okay. Now, in order to manage this, okay, he was given, of course, oral antibiotics because there is an infection. And at the same time, there is your oral rehydration solution. Example, this one. Now, looking at your oral rehydration solution, the contents are as follows. So it has your carbohydrates. I think the carbohydrate here is primarily glucose. Yeah. So it contains glucose, it contains your sodium, potassium, and a base, either in the form of citrate or bicarbonate. Kasi remember, in diarrhea, when you have diarrhea, you are losing all of those ions, be it sodium, potassium, bicarbonate, and chloride. Okay. Now, um, my question is why is it important to have a carbohydrate here or a glucose here? What does it do? Okay, it makes use of your sodium glucose transporter in 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 absorbing your sodium ions. Okay? So balikan natin to later on. So let's look at this one first. So again, this is your SGLT1. So this is the one utilized by your oral rehydration salts. So by putting glucose there, you are making your sodium absorb you are facilitating better absorption of your sodium. Yeah. Now, going back, take note of this one. Uh the World World Health Organization, they have two formulations of oral rehydration salts. So previously they did this one, the first one, the standard formula, wherein the osmolarity, I'm sure you're familiar with osmolarity, di ba? This was discussed in the first LE, di ba? So it has an osmolarity almost similar to that of the plasma. Okay? But what they found out is that because of the high content of glucose, okay, the glucose in this ORS further aggravates the dehydration kasi it attracts water, more water, instead of it preventing dehydration, it aggravates dehydration pa. Kasi nga it's an osmotically active substance, it attracts water further. Okay. So what they did is they lowered down the the concentration of glucose, making the osmolarity hypotonic relative to the plasma, 'di ba? So the plasma is around 300, the the osmolarity of this one is around 245. So it's hypotonic relative to the plasma. And based on what you've learned previously in LE1, 'di ba? What would be the movement of osmosis? If it's if is it from a hypoosmotic to a hyperosmotic or hyperosmotic to a hypoosmotic solution or compartment? Ganda. What's the direction of osmosis? Hypo to hyper or hyper to hypo? Okay, so someone answered hypoosmotic to hyperosmotic. Okay, so that's the correct answer. Okay, it's always from a hypoosmotic compartment or solution to a hyperosmotic compartment or solution. So by making this one by making the ORS hypoosmotic, it increases the movement of water further. Yan. Okay? So parang this is an introduction to renal na rin. Okay. So any questions? I think that's the last one. So any questions about GIT? Ayun. So sabi ko na may magtatanong nito. Okay. So good question. Okay. Doc, effective po ba na replacement sa mga ORS yung Pocari Sweat? Okay. If you look at the composition of Pocari Sweat and other sports drinks, it has a high glucose content and it has a high potassium content. High potassium relative to the plasma. Uh, it's not a good replacement for ORS because of yun nga, yung those two things that I've mentioned. High glucose content, a high sugar content. So it would further increase the osmotic movement of water back into the intestinal lumen. And at the same time, the high potassium content would also uh, change the wait. Ayan. So the high potassium content would can although not that high naman to cause hyperkalemia, but it can aggravate hyperkalemia in certain clinical conditions. But I think the primary condition, the primary problem there is the high glucose content. Yan. Pocari Sweat and your other sports drinks, they are good if you have excessive sweating. If you want to correct dehydration due to excessive sweat. But for diarrhea, I still think the best would be ORS. Yeah. Okay. Doc, you mentioned in the digestion of protein portion, wait lang of your asynchronous lecture that renin, the one with the double N or chymosin is secreted by infants after birth, and that this enzyme functions to convert the soluble whey into insoluble casein, which will be acted upon on by pepsin. We were taught in biochem that whey is easier to digest, so why does it need to be converted into its insoluble form if it was already soluble in the first? Again, I think this one, sige, I'll check references. Okay. So biochem and physio books. But I think as far as I remember, the purpose of again of chymosin here is to make or to convert the protein into an insoluble form. And by doing so, yun nga, pepsin can act on it. Yan. Pero I'll check with regards to your way. Okay? How about no sugar electrolytes? What about this one? For diarrhea? Ah, you no sugar, but it does not utilize your SGLT1, di ba? As a replacement for ORS. It does not make use of your SGLT1. So it does not increase the sodium absorption. Sodium will be absorbed, but it does not utilize your other means of increasing your sodium absorption, which is the main point of giving ORS, di ba? Of including glucose in your ORS. Okay. Another. Pero doc, bakit po siya pinapainom sa mga may dengue? Well, the dehydration in dengue is different. It's not uh, water loss in the GI tract, but rather it's a loss because of an increase in capillary permeability. So, I think puwede pa rin siya. ORS puwede rin, yeah, for volume replenishment in dengue. I think it's still case to case basis. So what I discussed is for diarrhea only. Yeah. Ayan. Doc, if the patient is in or nearing hypo-K, will a homemade ORS solution still be advisable? Ah, nakalimutan ko nga kung paano nga ba yung homemade ORS? Ma'am Tess, paano nga ba yun? Si Doktor Rakakas yung nagsasabi dun dati. I forgot kung ano yung composition niyan. But, homemade ORS is still a good, initial management for dehydration, pero hindi siya alternative. So, my point is, you still have to put ay to papuntahin sa hospital if in or nearing hypo-K. Yan. Doc, how about Yakult po? How does it make you defecate because of the bacteria? Ah, sino yung mga public health dito? Kasi I think there was a study about the um yung growth ng bacteria in Yakult, 'di ba? Can anyone tell us yung I think it's in public health eh. Yung or are you familiar yung sa study na yon? Anyone? Well, theoretically, the good bacteria, so by increasing your the colony or the number of your colonic flora, you facilitate motility. Uh, kasi 'yan, eto. So by by increasing the amount of good bacteria, you prevent the the growth of your opportunistic bacteria, which can cause certain conditions. And at the same time, as far as I remember, this good bacteria also produces, to a certain degree, uh, some some substances that can stimulate peristalsis, or that can stimulate GI motility. That's why they would help in promoting good bowel movement. Yan. Pero with regards to Yakult, as far as I can remember uh, it does not have enough. Tama ba? Correct me if I'm wrong those from the public health. Those who are graduates of public health. They do not have, yung Yakult does not have enough lactobacillus in that one to actually cause or to have a benefit. Yan. So probably nagkaroon ng problem along the way yung when you handle things that would contain uh microorganisms. It should be in a properly stored uh container. Yan. May cold chain yan, di ba? May questions. What conditions do the opportunistic bacteria cause? Actually, marami. One example here is, ano bang example? Uh, Clostridium difficile. So it's an opportunistic bacteria. So when your good bacteria when take in certain certain antibacterials. Yan. So when your good bacteria declines, this opportunistic bacteria, one of which, for example, would be Clostridium difficile, being opportunistic, they tend to flourish. And by doing so, they could cause your diarrhea. So, for example, yung pseudomembranous colitis. Yun. Ayan. Most recent paper po kasi that I could find on chymosin in infant only shows that upon sequencing of a region, it represented a human prochymosin which without a functional gene. So it would be unable to generate the protein chymosin. Sige, I'll check this one kung anong reference with regards to chymosin. Okay? Yeah. Doc, how about those who are fasting long-term due to religious or any other purposes? Should they take ORS or are electrolyte drinks enough? Hmm. Uh, will this yung fasting states? Yan. Kasi if you are after the glucose or if you want to kasi 'di ba in fasting states there are certain biochemical pathways that would tend to normalize your blood glucose level. Yeah. And I think in yung sa religious purposes, for example during Ramadan, they are not allowed to drink anything eh. So wala ring use yung ORS sa kanila. Yan. Yan. So someone answered that uh probiotics shortens the duration. Yes. So that's why in some instances in patients with diarrhea, we would also prescribe probiotics. Pero hindi Yakult ha. There are preparations kasi that would contain concentrated amounts of probiotics. Ah, is another question. Is there a difference in the mechanism of achieving individual tolerance in milk allergy or versus lactose intolerance? Is there a serious manifestation from unmanaged lactose intolerance? Uh, I think the main problem in lactose intolerance is it can result in dehydration. Dehydration talaga. Yeah. Ay, si Jan pala 'tong isa, sorry. Akala ko student. Sorry, si Dr. Shwatak pala 'to. Yan, so thank you, Jan. Yan. Okay. So, no more questions. All right. Sige. Ah, sige, few slides left. So, reminders lang for the lab experiment. So, for this coming lab session. So, this week, Tuesday, Wednesday, and next week. So, you are to do the following. So, so, so experiment 8, examination of the abdomen. And then you also have to do your experiment 9 and 10. So 9 yung glucose, capillary blood glucose and insulin. And the experiment 10 would be yung kidney function test. So under kidney function test, it has 4 different procedures. Okay? Now, um, this will be posted as an announcement then in Canvas. So what I want you to do is kindly assign. So if you are to to tabulate, so we will need approximately 14 subjects. For hindi pala 14, 13 subjects to do the different procedures in 9 and 10. Okay. So take note. So kindly assign na lang per group. Kayo na bahala for this one. Okay? But take note that the subject for this one, the oral glucose solution, student A, would also be the subject for this one, the subject for D7, yung glucose solution in procedure D of experiment 10. So same student lang yon. Okay? Now, in cases wherein you have less than 13 students, for example, 12, 11, 10. Okay. So, in those cases, you may omit, so you may choose na lang if either you are to do green tea or black tea. So again, this is for for the group that has less than 13 students, 13 members. Okay? 13 members. So, you have to choose either green tea or black tea na lang. Tapos, kindly omit decaf coffee. Iwan nyo yung brewed coffee. So, remove this. Sulatan ko na nga. So, for those who have 13 and below members, less than 13. So, you can omit this one and kindly choose if it's green tea or black tea. Okay. So, again, this is per group. Per fisio group. Tapos, you can get the result na lang of another group for if you omitted something. Kunyari, tinanggal nyo si decaf or tinanggal nyo si green tea, we can get results na lang from another. Just tell the facilitators. Okay, kung ano yung tinanggal nyo. Doc, what do you consider as regular soft drink po? Yung regular Coke. Yeah. Or regular Pepsi, not the zero or the diet, yung regular. Coca-Cola or Pepsi. Okay? And then if you can find yung sige, okay lang pala 1 can, yung 330 ml. Yeah. Okay? Any questions about this, the assignment? Ayan. Doc, my group only has 10 members. Okay. Sige. Message me na lang. Sige, for those who have 10 members, kasi medyo masyadong konti yon. So message me sa Canvas. Okay? So, few reminders again for this one. So, kindly take note of ay yes, Ma'am Eileen. Sige, before
And then
we
baka
go to this one.
i-remind mo na. Because for section C, they'll be starting tomorrow at 1 o'clock, diba? Baka
Yes,
nasa
ma'am.
reminders mo. Sige.
Ayan. So, this is also posted sa Canvas. So, please note that of this one, yung what I've shown you before, yung assigned procedures per subject. And then, please note that you need to do pre-lab preparation for each procedure. So, meron kayong kailangan gawin doon na fasting and you have to drink certain amounts of water before you do certain procedures in experiment 10. And then, for those assigned to do the 24-hour input and output determination, kasi you have to do it ngayon. Kasi if our lab session is 1 o'clock for tomorrow for section C, you have to start at 1 p.m. later. Yan. So you need to get a graduated cylinder and urine strips from the technician. Okay? By the way, for this one pala, pwede pala ma'am, no? They can start naman tomorrow. Wala lang yung result nila, no?
Yes, oo. Susukatin
Okay.
lang naman nila for
Oo.
the
Pwede pala, pwede. You can start pala tomorrow rin naman. Or pwede rin naman later kung gusto niyo. If you're near in URM,
yeah, yes.
you can get and then these are the things that you need, that you have to bring certain drinks, yung water, Pocari Sweat, for fresh buko juice, tas coffee, tea, yung soft drink, and then you also have to bring boiled sweet potato and eggs. So for experiment 10 and 9. And take note that it is only the glucose solution that will be provided. Okay? May question. Hi Doc, will you also be announcing which groups will conduct? I think na hindi pa ba siya posted? Anyway, for this week,
It's already in the schedule.
for this week, for tomorrow and so Wednesday, groups 1 to 8, and then next week groups 9 to 16 naman. Okay? So any other questions? Wait lang, I'll check lang if posted na sa Canvas yung announcement ko. Wait lang Naka-post na ba siya? Ayan, okay, I think it's posted na. Yeah. So yung reminders for GIT and renal experiments. And as well as there's also a video guide for the PE of the abdomen. So kindly watch it before your lab session. Okay, where can we claim our lab manuals? So lab manuals are already available outside our office. Ayan. So going back to this one. So Doc, 11 members po kami. So probably you can choose, yun, remove decaf and choose green tea or black tea lang. Maging 11 na yun, di ba? So minus 2. Yeah. So 11. Okay? And then for females pala, if you are assigned to do this one, yung experiment 10, and you are on your period, please ano na lang, swap na lang kayo with another subject na gagawa ng experiment 9. Yan. Okay? Yes, Ma'am Eileen.
May I just remind the students kasi may mga nagtatanong, no, kung what groups will be assigned next week or this week. Kindly check, papakita lang ako. Kindly check Canvas. Okay, under general information, you have there the schedule. Okay, schedule for LE4 period, LE5 period, LE6 period. It's there. Please refer to that. Okay? Para hindi tayo lost. Thank you.
Yan. So, yan. Tama. Check first the schedule before ano. Tama, Doc, tama po ba if 12 members po, we choose between green and black tea, or ang alisin po namin is decaf? Choose muna between green and black tea. Yan. Okay? So, may Any other questions pa? So if none, again, for those who have 10 members or less, message me sa Canvas para ayusin natin yung assignment. Okay? Alright, so thank you. So that's it for today. So again, for questions and clarifications, post them in the discussion board. Okay, or you may message me in Canvas. Alright. Okay lang po ba green tea with mint? Okay lang ba yun?
Mas
Andyan,
maganda kung ano, plain na green
plain
tea.
green tea, yes. Right. So, sige. So, if no more, sige, let's call it a day. So, you can guys leave na. Thank you.
Thank you po.
Thank you po, Doc.
Thank you, Doc.